Good morning. So, this is Pushing Boundaries, a podcast about pioneering research, breakthrough discoveries, and unconventional ideas. And I'm your host, Dr. Thomas Verney. My guest today is Emmy Vadnais. Do I pronounce it correctly?
That is the French correct pronunciation. We say Vadnais here in Minnesota, but that's correct.
You say Vadnais in Minnesota? Okay,
Yeah.
so for our American listeners, it's Vadnais, and for Canadians, it's Vadnais. And she's an occupational therapist, intuitive healer, integrative health practitioner, health coach, teacher, consultant, and author of Intuitive Development: How to Trust Your Inner Knowing for Guidance with Relationships, Health, and Spirituality. Boy, that's a mouthful. Yes, she is the founder of the Holistic OT community at holisticot.org, where you can reach her and find out more about her practice. And she's, in fact, in private practice in St. Paul, Minnesota.
Yes.
Okay, well, welcome, Emmy. I'm just really looking forward to hearing about, intuition and how you coach people in intuition. Perhaps you can tell us a little bit about that.
Sure. Well, I got into intuition many years ago when I was a new occupational therapist, and I sort of hit a wall here in the United States. That was when, well, it's been happening for a few decades now, where managed care has come in and high productivity standards. And I found myself getting very disillusioned and burnt out, actually, very early on, sadly, in my career. And I stopped working as an occupational therapist and really wasn't sure what to do. And I'd always been interested in holistic, sometimes referred to, although there's a lot more research now, so I don't really love this term anymore, but alternative methods. And I started taking some classes in Qigong energy healing because I always thought those meridians and the acupuncture chart were fascinating. And I had heard about how a couple of physical therapists said that they could positively impact a person's physical and mental health and well-being without physically touching them. And if you know anything about physical therapists, or for those listening in Europe or maybe Canada, they sometimes are referred to as physiotherapists, but essentially they're the most physical oriented because they help people with their joints, with walking. Actually, occupational therapists work very closely with physical therapists, and there's a lot of overlap. And over the years, there's been discussion about making it one profession because a lot of people don't understand what OTs do, but we help people to be as functionally independent in all aspects of their lives. A classic example is if a person had a stroke and isn't able to brush their teeth or get to the bathroom independently, all the way up to helping somebody who maybe had some type of injury and they want to get back into their golf game. At any rate, I started taking these Qigong classes, and I started, a big part of Qigong is meditation. And I met, so not only did I have a Qigong teacher who was trained in China, but I also had met a person in those classes, Betty Ann Ertwine, who became my intuitive development teacher. And it was really a lifesaver for me because I was going through so much stress and anxiety. And I found that this really could calm my mind, my soul, but also help me to access a part of myself that, Dr. Verney, I know that you share in your book about how we can have consciousness in and out of the body and the brain. And I was able to pick up on people's health and well-being, or where they had blocks and challenges within their whole mind, body, spirit, without physically touching them, and sometimes them not even verbally telling me. So for example, when we were doing the training, we would have people fill out a client health intake just for practice clients. And not uncommonly, they would forget to share maybe some part of their health history. And as I was going through assessing the meridians and their auras and so forth, and the chakras, those energy points, I would pick up on aspects of themselves that they hadn't verbally communicated to me. And so this just happened over and over, that I realized there was something else going on. And so for many years, I developed that skill when what's formerly known as alternative medicine was not as popular. There wasn't as much research. And I really felt like I didn't have, a lot of times, life is quite a journey for everybody, but I really felt like I didn't have a clear path after I'd spent all these years in college to become an occupational therapist on how to go forward. And it was really my intuition that led me forward. And so over the years, I've learned various techniques to help improve that for people. And now I teach continuing ed classes to healthcare professionals in what's now known as more integrative health, since we know there's more research. But there's a strong component of helping people with developing their intuition, which is something we all innately have. It's really just uncovering it.
So if I was one of your clients and came to you and asked you to help me develop my intuition, how would you go about it?
Well, I would first ask you, when did you know that you listened to your intuition? Or meaning, like, a lot of people, so first I like to kind of ascertain with somebody. A lot of times people will say in life, I should have listened to my gut, or I knew better, right? And I'm sure you as a psychiatrist have heard that over and over the years. And so I think that establishing a baseline for each person, because everybody's unique in how they listen to their intuition, I like to find out, so I mean, I'll ask you now if you want, Dr. Vadnais, is there a time in your life you knew that you were listening to your intuition?
I was just thinking while you were talking about question, and offhand, I don't know. I really don't know. I'm sure I have. I'm trying to think.
Well, another way to think about it is when in your life did you achieve something that just felt right to you? So for example, you became a psychiatrist. I believe you have a family. And so when you made those choices, how did you know that those felt right to you when you were in the beginnings of those various processes?
Well, psychiatry always felt right to me. I never doubted that. But I certainly doubted my marriage, my first marriage. I knew almost right away that I made a big mistake. So I would say that I have kind of a negative intuition. I said to myself, "Oh my God, what have you done here? This is going to be a disaster." Then it took me 13 years to get out of that. But yes, it was a disaster.
Oh, I'm sorry to hear that. Well, thank you for your honesty with that. And so when you think about that, and you can think about this yourself, but when I work with somebody, I'll ask them, what senses, or how did you know? Was it a thought, a feeling? Most people describe it as just a knowing. Oftentimes intuition is synonymous with an inner knowing, or they'll say I had a gut feeling, or some people will actually have dreams, or they can even have precognitive insights. They can be flashes of insight. Another way that intuition can come to us is sort of messages that seem to come, just kind of, they drop out of the universe and just keep coming to us over and over. Like maybe we'll hear something on the radio, or maybe listening to a podcast, or driving down the freeway and seeing something on a billboard, or maybe various conversations you have with people. You might hear sort of some of the same themes coming up. And so I feel that that's a way of our inner knowing giving us messages, depending on a person's belief system. They might believe that it's the universe. They could feel that it's some form of spirituality. So intuition can really bump up into that spiritual component, because it does seem to go beyond our physical senses, or can also include that. And for some people, they believe that it's really God directly communicating with them.
So, in terms of the many things that you do, you also talked about health, how you can help people get healthier, I suppose. That's part of your coaching, right?
Yes.
So I would imagine that you are familiar with Edgar Cayce's work.
Yes. I mean, I'm familiar with who he is and some of his work, but I haven't studied it like super deeply.
Was, because I believe he's passed away.
Yes.
So do you do any sort of at a distance healing also with people the way he did?
Yes, I do. And yes. So just to kind of dovetail with your previous question about how I would help somebody with coaching, another component is helping people to quiet the mind. while yes, intuition can come in dreams and you can set an intention to have dreams, or it can come in as flashes of insight, and some of the other ways that I mentioned. If we want to have it a little bit under, for lack of a better term, under our control or volition, we can develop ways or methods of really inducing what's known as the relaxation response, getting into that kind of alpha theta brainwave state, so that we can quiet the thinking, the judging, the perhaps even negative emotions. Although sometimes, like you described in your first marriage, you can have an uncomfortable feeling that can be an intuition as well. But we want to be able to kind of clear the mental and emotional palette, if you will, to receive and get that information. And thank you for bringing up the aspect of health. So one of the ways that intuition dovetails with health, I mean, there's many ways. I think that intuition can really help people make good decisions in their lives and have good insight going forward that works best for their own particular, again, this gets into belief systems, but this is, you're talking to me. So I do believe that we all have an element of karma, or so we, right? We all have our own unique meaning and purposes in lives, in our own lives. And so we can get more in tune with that to live a more fulfilled, happy, meaningful life. So to me, when we do that, and there's research that supports this, that meaning and purpose is really paramount for living a joyful life. We know from people like Viktor Frankl and great research that that's really important. And when we're out of alignment with that, we can get depressed. We can feel that we don't have worth. We can become apathetic. And Dr. Vadnais, I know that you, working with patients, have probably helped many people to come to more meaning and purpose. So aligning with that intuition is really aligning with your own soul, your own soul's purpose. And also I would say love, because love to me is the greatest healer. I know you and I both touch very much on the aspect about how important the heart is, and how our hearts, there's even so many phrases that talk about listen to your heart, trust your heart. What does your heart say? My heart feels heavy.
Broken heart.
Yeah. Did you say broken heart?
Yes, I did. Broken heart, right.
Absolutely. Yeah.
So since we are talking about the heart, you have been practicing now for a few years, I imagine. Has there ever been a patient who really touched your heart?
Every single one. Although I learned from everyone, and I feel that when I'm connecting, I really feel, with an individual, I feel that my heart opens even more every time, because I bring that love. I am a very loving person, and I feel that helps another person to feel safe, to open up, to really be their vulnerable, authentic self, because that's how we're going to get anywhere. But when you say that, of course, a few people do come to mind, and so many, because I really have learned from every individual I work with. I've been an occupational therapist now since 1996, so going over 25 years. I started developing my intuition in 2000, so I've been practicing it for 20 years. I started teaching it in 2006, so I have many years. I've worked in a hospital helping people who were dealing with very acute and sometimes chronic pain, stress, and anxiety, where they'd be on medications, and even were seen by the pain doctor at a major hospital in Minneapolis, and they weren't able to get those pain levels down. But by doing various forms of guided meditation or guided imagery or various forms of relaxation, like maybe a good foot massage or reflexology, in under 15 or 20 minutes, and as part of a research study, we were able to get not only the physical pain and stress levels down as well, but also that emotional anxiety, and giving people hope, which, as we know, connects to a more healthy immune system. It can help a person to get those, the aspects of the body that can cause inflammation down, so that a person can literally heal from and prevent various diseases, and also get into that heart rate variability that now has a lot of research that shows that the more heart rate variability we have, the more resilience we have, the more that we can cope with challenges that come our way. And so, but when you ask about a person who really touched me, so many come to mind, but one that comes to mind is an individual who I worked with at the hospital who had a car accident and was sadly in a rollover and had a spinal cord injury. And this individual, from the culture they came from, really believed in. So yes, I also provide energy healing, which is just a term, but basically helping people to be well without physically touching them. And because we know that consciousness is non-local, or really is one mind, we don't have to be physically close in proximity to positively impact somebody, or possibly even negatively impact somebody with our thoughts and intentions. But this person really believed in what I had to offer, and I primarily did a lot of energy healing for them. And so they really recovered quite nicely. And I believe they are now walking after having suffered a spinal cord injury. And there are, of course, cases where people have spinal cord injuries, don't receive energy healing, and may or may not walk again. So I'm not suggesting, I don't know for sure how much of my intervention impacted it, but I do think that it did, not only because of what I did, but also because the person believed in what I did. Belief, as we know, is 90+% of our health and wellness, and what we believe to have will be true or is possible. But also, I think that we got really in sync and harmony together. And that's what I love doing when I work with people, because that really raises that vibration for possibilities and for people to come again into that connection of their true selves. So it's really a pleasure to do that.
So when you say energy healing, and I thought that there was a name for that particular way, when people just kind of put their hands over your body but don't actually touch it. Is there not?
There's different lenses, if you will. So there's, like, I was trained in something called Qigong energy healing that comes out of China. And when you look at the history of all of these various forms, like in Christianity, it's laying on of hands. Japan, it's Reiki. It's channeling universal energy, or moving universal energy, or the spirit. And really, it's just different sort of cultural perspectives or lenses. When you look at the history of how it's kind of like the Silk Road, the spice trade, it just sort of moves around, and people have different ways of working with it. But it's all essentially, we're all human. We all have, we're all very similar, really, at the end of the day.
So when you were doing your Reiki healing or energy I'm familiar with Reiki. I haven't heard the other two.
Mm-hmm.
When you were doing that, what are you actually experiencing, you yourself, as you are trying to do the healing? What is going on in your mind?
Yeah, that's a great question. So I'm using my intuition. That's how it really grew for me. And that's why I brought up that initial Qigong energy healing training. Not only did part of that training is that we cultivated our own energy. So we learned how to meditate, go into deep meditation. And it's sometimes referred to as internal martial arts, but essentially it's moving the energy within ourselves. And we all do this every day, whether we realize it or not. A simple way to think about it is, where do you feel the aliveness in your body? Where do you feel calm, peaceful, maybe even a sense of levity, or maybe a sense of imperceptibility, that maybe things just feel so good, it's just humming along fine? Or where might you have some tension or distress or discomfort in your mind, your body, your heart, your soul, your spirit? That's where the energy probably isn't flowing as well. And so you can just start getting a felt sense yourself with that. So I was trained to use myself, my body, my being as an instrument when working with an individual. So what's happening for me is that I'm using all of my senses, including intuition, but meaning the 5 senses we think of. And some people are more dominant. So for example, I'm work very empathically. People have heard that term, being an empath. Most people, I'm sure, Dr. Vadnais, you probably are as well. When you go into healthcare, I think a lot of people are. And really, we all, to varying degrees on a continuum, can pick up other people's feelings and thoughts, whether we are aware of it or not. And sometimes we think we have our own thoughts, but it could be somebody else's. And so that's an element for discernment. And so I'm using what I might see, what I might feel, what I might hear, smell, taste when working with an individual. And also I feel their emotions and sometimes can hear their thoughts. And so that helps me. So when I'm working with an individual, I always set out with the intention of whatever is for their highest good and greatest joy. I know they're only going to share with me what they're comfortable sharing on that spiritual, psychic, intuitive level. And that I'm going to I've learned to trust over the years that I'm going to pick up on and serve them in the way that is really for their highest good and greatest joy in this particular moment. And so I just trust. And a big part of intuition, I think, where people can get blocked with it is that they have doubt or they don't trust it and they question it. And that can kind of block it. But intuition is also receiving information. That's why we kind of want to have as still waters as possible to receive that information. So by being in that place of trusting and allowing, we can let that information come forward. And then I listen to, over the years, I've kind of refined, like, what is the priority here? And not surprisingly, a lot of times, not always, but a lot of times I'm guided to go right to their heart, because you mentioned it, a broken heart, which I'm sure you've seen over and over, is that a lot of times people do have unresolved grief, wounds, abandonment, maybe something that they're still beating themselves up about, maybe something that they're needing to forgive themselves about. And so then I just, I can also see, it's sort of like X-ray vision. So I can see where the energy, where I see it as light, where the light is flowing in and around the body and where it's not flowing. And that tells me where there are blocks. And then I'm trained to connect with that universal energy. So it's the heaven and the earth energy, and I'm a conduit. So that's why I have to do my best. I'm a human. I have my foibles too. I'm always, continually trying to be my best. And then I can be a channel, kind of like a river or a stream, to channel that energy to the individual. So at first it's assessing, it's getting priorities. It's, and then I sometimes dialogue with them while I'm working with them. Sometimes it's quiet, but sometimes I find dialoguing with them can help raise their consciousness to focus on what we're working on together. But sometimes it's best for them to just be quiet, relax, and receive, because as we know, some people can be so up in their heads that they can just start spinning. And then I spend as much time, with this, whatever the schedule, we have blocked out allows. And most people feel much clearer and lighter. And then I'll highlight to them areas that I've assessed and worked with. And I might hear messages on what could help them going forward. So sometimes I may be guided to put essential oils on a particular acupoint, or maybe I might hear a message, which is very common, to hear a message. Sometimes I even channel a past loved one that might come through. Or it could be that a current relationship with somebody who's still living, that either I might validate a close connection, or there could be some disharmony in a relationship that the person may or may not be aware of is really causing them some deep disharmony in their psyche, to help them to maybe take some steps for healing in that regard. So there's a lot. I mean, those are just some examples, but there's a lot that can happen.
And they sort of make me think of working with dreams. It's something that I've been interested in forever, since I was 12 or 13 years old, when I read Freud's interpretation of dreams, and I fell in love with that. And when I start working with a new patient and I ask him or her, did you have any dreams last week? They look at me like, why would you ask that? Like, what has that got to do with my anxiety, right? Or my depression? And what I have found, and this is where I see the similarities, is that the more we focus on our dreams and the more we pay attention to them, the more revealing they become. So it's very much like what you are saying about intuition, that as you become aware that you actually have that, which most people don't even perhaps think about having, the more you realize that this is a source of healing and information and all the other things that you mentioned, the more they will serve you. So I think this is really important for our listeners to realize that paying attention to your inner life is just so important, right?
Yes. And I love what you say about the dreams. Absolutely. And that's something that, now that you mention that, I've been paying more attention to my dreams, and I will ask people. I haven't actually asked too often, what dreams have you had lately? I think that's a great question. And it does make me recognize as well that even though we have physical bodies, and anybody who's maybe dipped their toe in or studied, or maybe you're new to understanding chakras, it's really levels of consciousness. So we have the physical world is the first chakra, and then it goes up to the second, where that's more of our kind of primal needs, like money and sexuality, creativity, which are necessary and pleasurable. But that's also more can be, of course, there's a merging of energy and spirits if you take it to that level, but that can also be very physical. And then we go all the way up to the heart and the communication and the consciousness and the mind, and the seventh, which is a connection to the all. But they're all just levels of consciousness, really. And that's what we're working with intuition.
Right. So going back to your childhood, was there anything in your childhood that sort of set you on this course to discovering intuition?
Oh, that's such an interesting question. I was the youngest, or am the youngest of four in my family. I have three older brothers. I have a younger brother from my father's third marriage. And I was the youngest and also the only girl. So my mom and I were two peas in a pod. And so I think that I picked up a lot of her beautiful empathy and ability to, while yes, I was energetic and liked to talk and very active, I also realized that I was picked up on a lot and was quite an observer growing up. And so I think that, and like many children of the 70s, my parents divorced. And so I think that I really, like a lot of children of divorce, your senses can get heightened. And so I think that I was really aware of all that was happening. And even when I look back, because I was quite young, I think I was 6 when they legally divorced, my perceptions of what was going on were quite accurate at the time. But it wasn't really until I think that I was in my teens that I had a really solid experience of intuition that made me recognize. So I think that naturally I've always had a peacemaking kind of quality to me, a person who wants people to, to feel love and happiness and connection and all of that. But when I was an older teen, I had a brother who got married, and I actually dreamt, speaking of dreams, of his wife's pregnancies. And this was before this person had an ultrasound. I knew the sex. I knew what the child looked like. I knew the personality. I dreamt of this child for about a year until they were born. So when I went to the hospital and saw my niece, who was actually my very first niece, I have several nieces and nephews now, I felt I was meeting them again. It didn't feel like the first time. I knew that they were going to have dark hair. And that happened again for 2 of the other pregnancies, where I had a dream that they were pregnant. I knew the sex of the child, the personality, what they looked like. And this was again, each time it was before the person knew they were pregnant, or the one time I called them and left them a message. This was on the days of answering machines. And I said, I had a dream you were pregnant. And they called me back and said, I just got back from the doctor and found out I'm pregnant. So this was like, she was maybe 4 weeks pregnant. Right. So yeah, so I had these experiences, I think, to tell me that we think about, there's near-death experiences and people having after-death communications, but this was a pre-birth experience. And I talked with Jeffrey Mishlove about it, and I think he said they're called announcement dreams or something like that, but they're typically dreamt by the mother or the parent of the child. Now, I don't have any biological children of my own, but these children are the closest to me and feel like the closest I'll ever have in this lifetime to my own children.
So your parents divorced when you were 6 years old?
Yes, they did.
And are you still in touch with them?
Yes, my mother passed a year ago from Alzheimer's, and my father is 80, and he's at the beginning stages of Alzheimer's. But yes, have kept relationships with them over the years. My dad, it was sketchy there for a while, but we hung in there.
before they went into Alzheimer's, did they approve of what you were doing with your life?
Yes, thank you for recognizing that, because that's really helped me in a great way. In fact, my mother was a writer and a journalist, and also she became a professional mediator later in her life. And so she helped me with writing over the years. Although when I wrote my book, her Alzheimer's was coming along quite strongly at that point. And so, I realized that I had developed a lot to be able to write my book. And my father, even though he's at the beginning stages of Alzheimer's, he will frequently say, "How's your writing going?" And he'll tell people, "My daughter's a writer." So he's really proud of me. And I'm even though we've had challenges over the years, I'm grateful for that, for sure.
Well, since you mentioned your book, let's mention it again, just so that our listeners know what you have written. And where can they buy this book? Is it on Amazon?
Yes, it's on Amazon. Yep, Intuitive Development. And then also on my website, emmyvadnais.com, I have a book page there where you can order it directly from me if you want. But yeah, Amazon is probably the easiest way for people to get it as well. And then it's also available through Ingram Spark. If anybody has a local bookstore and wants to get it in their area, that would be a distributor to go through.
Okay. So is there anything coming up for you? Are you working on a new book?
Oh, thank you for asking. I'm still and I feel like I put so much into this book that at this point I don't have anything new to say yet at the moment. And since I put so much in the book as far as different methodologies and research, not only for intuition, but how it dovetails into health and prevention of disease, I feel like this fall, for example, I have some classes that I'll be doing if people want to work with me that will coincide with the chapters of the book to get stronger in listening to and uncovering your intuition, which it's about connecting deeply with yourself, but it can also go into those realms of psychic development, really, of being able to pick up on, with ESP, telepathy, and so forth as well.
Are there certain types of people who have more difficulty getting in touch with their intuition?
Well, yes, the folks who tend to be up in their heads, more analytical, can have more difficulty kind of wrapping their heads around it, excuse me, and kind of feeling into it. Doesn't mean that they can't develop it, but those are the folks who tend to kind of overanalyze. I think if I remember correctly, like in the Myers-Briggs, the INFJ or INFPs tend to have a little bit easier time. Those are correlated with the highly sensitive people, and the folks who are, I think, is it STPs or STJ types who are more analytical, might question it more, and that questioning can kind of block even just sinking into it and allowing it to be there, or recognizing that it's there.
Yeah, I guess it's the same with hypnosis, the same idea, people who are too much in their heads.
Yeah.
Subjects.
Yeah. And that's why I think things like meditation, although some people even bristle at that word, I think they feel like it has to be overly disciplined, but I've came to it quite formally, and I still have a formal meditation practice, but I've learned to lighten it up over the years and make it more playful and enjoyable. And I do have a yoga and asana morning practice that I do. And when I first started doing that, I think I was quite rigid in my approach, and it was very serious and very disciplined, but I've loosened that up over the years because I realized that it's ultimately about feeling joy and love. And so if a person can engage in activities, and we know from Dr. Herb Benson, who coined the term the relaxation response, that if we can engage in activities that help us get into that relaxation response state, yes, meditation, guided imagery, hypnotherapy can assist with that, but it could be as simple as going for a walk in nature, or just sitting in nature, or gardening, or making a really lovely meal, or taking a bath or a shower, or laughing with a friend and just kind of loosening up. Or like you say, with dreams, right? Sleeping, taking a nap, there's the hippocampic and hypnagogic states where we're going into and out of sleep. Or one of my favorite activities is just looking out the window and daydreaming.
Mhm. So speaking of that, what would you say, can you recall one peak experience in your life when you were absolutely happy, really, really happy?
Mm. A couple come to mind. So going back to, well, I'll go to one in my adult life, was when I graduated college.
Mhm.
That was a huge accomplishment for me. I double majored in psychology and occupational therapy, worked very hard. It was a very difficult program, but I really rose to it. It was definitely the right thing for me to do, to take that path. I did very well, and I was very happy with that, and grateful to have that. And then also I would say when I was a little girl, probably about 2 or 3, eating raspberries in a neighbor's raspberry patch who gave me permission to do so in the sun on a sunny summer day, and just feeling bliss.
Oh, that sounds great. That sounds really wonderful. In
With
fact,
those sweet raspberries.
when we finish talking here, uh, in fact, I'm planning on going to a strawberry farm just outside of town where they have freshly picked strawberries every morning. It's fantastic.
Oh, yummy.
So much better than what you can get, at the supermarket, because it just smells and it's just so delicious. Yeah.
Yeah, and it brings us into that pleasure, that joy, and it brings us into the present moment, right? When we're
Right.
thinking about the past or the future, or worrying or ruminating, which is so easy to do. And I know it's something we need for a certain element of survival, for sure. But yeah, being able to just enjoy the moment and be is lovely.
So here's a difficult question. Uh, what does it mean being human to you?
Hmm. Well, what it means to me being human is having many experiences. And for me, I feel being human is, I believe we come to earth to evolve and grow spiritually in our consciousness, to be loving, to be kind to ourselves and others. Yeah, and to be gentle with ourselves, and to recognize that we're all, while we might feel we have differences, that ultimately we're all really the same, and to recognize our similarities and to be patient. Dr. Verna, you and I met where I actually interviewed you on New Thinking Aloud.
Right.
And and I started my own podcast, which is how I met Jeffrey Mishlove about 4 years ago. I interviewed him for my podcast. Is I really learned how to listen to others and to recognize how we all have unique perspectives. And I just keep being reminded of that over and over. So I think there's a lot of learning happening being a human.
Well, I totally, absolutely agree with everything that you have said. I feel the same way, and especially in these very difficult times, it's just so important to try to keep your humanity, right?
Yeah, absolutely.
Not easy, because we are just being assailed with bad news from every corner.
We are, and there are bad things happening, and at the same time, there's a lot of good happening as well. You know, a focus of mine with intuition and the psychic functionings is being an interviewer with New Thinking Aloud, and I recently had the pleasure of interviewing a woman, Evelyn Elsasser, out of Switzerland, who researched spontaneous contacts with the deceased, where people have experiences of past loved ones coming to them in various ways, in dreams sometimes, or waking in visions, or in very electronic methods. And while we might see, like in paranormal shows on television, that these can be scary experiences, the research shows that I believe it's about 90% of people, I think it's that high, find that it's a very comforting experience to connect with a loved one, and that it's very healing and can help with grief and help them to reduce their fear of death themselves, and to realize that there is a benevolent, loving, connection, maybe a higher being, and an afterlife. But very few people actually are scared of the experience. And the ones who are scared, typically it's because it's just out of their worldview, or the way that it came to them just didn't quite make sense to them. But then we have these shows that make it look like these scary, haunted houses and horror aspect to it, which is most people don't experience it that way. So when I think about like the news, yes, there are really awful things happening. I think the important thing, or at least where I'm at the moment, is to listen to each other, and to, when we think that we're right about something, we may be, but to be open in how we communicate with others so that we can allow for their viewpoints as well, because we all really want to feel seen, validated, heard, and that we matter. And if we can do that for others, and then gently maybe offer another viewpoint, maybe they'll listen to us better. I don't know.
That's beautifully said, really. I cannot add anything to that. So in conclusion then, before we run out of time, what would you like to be known for? Let's say 50 years from now, when you pass, what would you like to be known for?
That I was a loving and kind person, really. I would also, I think that really just making it a better world, and helping others to do that individually and collectively.
Thank you. Thank you, Emmy. My guest today was Emmy Vadnais in the United States, Emmy Vadnais in Canada, and intuitive coaching and many other wonderful ideas that you shared with us. Thank you very much for that. And I just want to say that next week I will have Dr. Matthew Reagan on. He is assistant professor of animal physiology at the University of Montreal. And in addition to that, he's also a musician and a songwriter. So that should be very interesting. Thank you for listening, and see you next week. Bye-bye.